Struggling with hair loss? Learn how a hair transplant can be a game changer for you. In today's video, we are going to discuss a grade 3 male pattern baldness and his 7 months result. Please note that still some growth is there to happen. It's not the final result. Around 30 to 40% more hairs are about to grow. We are going to discuss in this video our app which predicts the kind of results you can expect after your hair transplant in this video itself. So please stay tuned till the end. I'm Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon and a board certified hair restoration surgeon in this field for last 17 to 18 years. So this 27-year-old male patient came to us with a history of 2 or 3 years of hair fall and hair loss which was continuously progressive, and now his sides were receded, his hairline had receded, the temple points had receded, and he wanted to seek a permanent solution for these areas. So as is customary at our hair transplant center, we did a trichoscopy for this patient, and the trichoscopic picture of the donor site was very good. His average density was above 80 follicular units per centimeter square. His average thickness of hairs was also quite high. It was 0.073 millimeter in this case, and his terminal is to vellus ratio was also very good. That means more than 90% of his hairs were terminal. Then we calculated his total donor area, and we found out that his total donor area was around 140 centimeter square. In total, he had more than 11,000 follicular units available at his donor site. His coverage value was also very good. It was 13.4 or more. Average number of hairs were also very high per follicular unit. It was around 2.3 hairs per follicular unit. Please like the video. In the next step, we calculated the recipient area in square centimeter, and we found out it was between 46 to 47 square centimeter, both sides combined. We planned to give a density of 35 follicular units per centimeter square in his case. This reached up to a number or a figure of around 1624 in this particular case. His 1, 2, 3 and 4 hair follicular units and the number of hairs total are mentioned on the screen for you to see the details of this procedure which we had done for him. If you are also planning a hair transplant for yourself or somebody you know, you can always call us at the numbers mentioned on the screen, or you can WhatsApp us your pictures so that we can try to help you out with your hair transplant planning. So discussing the procedure in brief, in his case, we did a hairline marking, then we trimmed the recipient site, and after giving local anesthesia made the site first for the required number of grafts, and after that we extracted the grafts. And in our extraction machine we have a counter which shows you the exact number of grafts which we are extracting for you in your particular case. Later on he kept on coming. We gave him all the advices which he has to follow, which he followed very diligently. He kept on coming for routine follow-ups and for the PRP treatment later on. And at 7 months here you can see his before and after pictures. Please remember that new hairs can keep on coming after transplant till 12 to 15 months, or sometimes rarely even later on. So this is just a 7 months picture, and in this case you can see there is a remarkable difference in his before and after pictures, and still much more to come. Many hairs are still yet to come, but it is a very life-changing experience for him. Patient is very happy. We request you to subscribe to our channel to keep on watching such useful, knowledgeable videos which give you a peek into the things which happen behind the screens when we are planning a hair transplant for any patient. Now coming to our artificial intelligence app, it's by the name of Saraswat Hospital, which is the name of our hospital also, and it has some features like PeekAI, which is a trademark feature which gives you a peek into the kind of results you can expect. So we request you to download this free of cost app and just fill in some information, and there's a feedback from our American board hair restoration surgery doctors who look at each and every case and give you a feedback, also give you a list of questions which you should be asking, and the rough number of grafts which you can expect to be inserted or planned in your case also. So coming to some takeaway messages or points which we always describe in all our hair transplant videos so that you know from where you should plan out your hair transplant. Always check out for the degrees and qualifications and credentials of the doctor who is going to perform the procedure on you. Number 2 is to check out how the transparency of your grafts is maintained by the clinic. Number 3 is to talk to a few patients from the clinic who have undergone a procedure from the clinic and to take their feedback. Sometimes people are very apprehensive about the pain. Number 4 is the kind of instruments the clinic is using, whether using the disposable punches or not, or whether they are reusing the same punches many times. And number 5 is to check out the team. Is the team permanent for that center, or is it a roaming team which comes on the day of the procedure and then goes off? So these are the kind of things you should avoid or do to increase the chances of your hair transplant. If you are planning for yourself or your family members or friends are planning a hair transplant themselves, you can share these videos with your family members so that they know what things they have to look out for, what is the kind of reasonable result they can expect at 7 months, although it's not the full growth. So this is my humble request to you to share this video with them. Also, if you want to know step by step about the hair loss treatment and hair transplant, you can click the video on the left, and if you want to see another of our result of hair transplant, you can click the video on the right.